colleague Emily, wanted to just let you know that within the school setting, because it is still essentially an academic and intellectual knowledge place to go for people, we are trying our best each year to understand our learners, to understand our communities, and to get as much funding and support and resource within our schools so that we can attack and attend to a number of the things that I just talked about in terms of all the wellness areas outside of just the academic. That being said, there's few of us, and some schools don't always get all the supports that we would hope. And so we can't be everything to every student. So we do need community, we do need parents and natural supports and other people in your child's life that we can kind of work together with at times and kind of wrap around when we really have some challenges that maybe we only see or maybe you only see. But if there is a need in one of those community or home or school environments, we do want to be a part of that conversation because we see our kids for such a significant period of their day, of their week, of their lifetime. So when we look at understanding, and you look at understanding what your child needs from you and from the environment, from school, from community, in this more wholeness, as opposed to just mental or just physical, but how they all relate to each other, it'll be really important for how they grow through some of the challenges that they might have or might be experiencing in the future. So if there is more community that they can attend to, something within the school that we're unaware of, it's really important. And I've seen great success when parents are able to build those connections with your teachers. Now, you might have had some struggles with that in the past, maybe teachers not getting back to you, maybe you didn't know if you were allowed to reach out. I would encourage you, get to know your kid's teacher or teachers, your administrators at the school. They can be your best advocate and ally when it comes to them letting you know how things are going and just giving you a heads up, and vice versa. When your kiddo is having a rough day, a rough morning, and you think, it might be a challenge for them and you have that connection established, send a text, an email, a phone call to the school just to give your other support team, the caregivers at school, the teachers and all the people there a heads up, and we can work through this together. Because there's a lot of energy that, we've all kind of, given through this pandemic. And, if we're raising a uniquely gifted or specially able person in our homes, or have a few of them, the energy that takes. So we got to take care of ourselves as parents, as caregivers. And I implore you to please consider that taking care of you. If you can build that wellness in yourself, then you can then instill and bring wellness to others. But it has to start with our own well-being, because this does take work, it does take energy. And as much as, not to loom and gloom on everybody's day in terms of the needs that we're seeing in school, there's also been so many beautiful things and lots of strength and resilience and hope in the messages of kids coming back to school, and in just a lot of people just adapting and doing a lot of remarkable things as well. So I will stop there, and because I really want to hear my colleagues and other people present. So I'll bring that back to you, Barbara, and then I'll stick around for some questions at the end if there's anything.
Thank you, Liam. Thanks so much. I think something that Liam really touched on that resonates with me and with the communities, the schools that the Calgary Place Youth Foundation works with, is that a lot of the mental health issues that people have should be and need to be destigmatized, so that parents, caregivers, guardians can talk to their teachers about what their child is experiencing and not feel any reservation or that they're going to be shamed for that, because really the schools really are interested in that whole child wellness, the physical, the mental, the educational, because without all of those pillars, we're not going to see the success that that child could potentially have. So thank you, Liam. Thank you for talking about those things. So next up is Emily Jackson. Emily's going to be talking about depression and anxiety in children and youth, recognizing signs and symptoms when your child is struggling with mental health, and what to do when your child is struggling, and as well as some mental health resources. So welcome, Emily.
Thank you, Barbara, and thank you, Calgary Youth Police Foundation, for putting on such a wonderful webinar today. My name is Emily. Hi, everybody. Welcome to the presentation today. I'm a registered social worker here in Calgary and a mental health therapist. In my private practice, I support young people and parents. I also have two children aged 12 and 13. So just like you, I'm living this experience too. My interest in children and youth mental health started during my clinical internship at the Alberta Children's Hospital in the mental health inpatient unit. And as Barbara mentioned, I'm going to talk to you today about depression and anxiety, the signs and symptoms, what you can do to help support your children, and where you can access help if your child is struggling. I'm just going to put my presentation on for you. Okay. So first off, signs of depression. These are the common signs of depression. Now, each and every child will show different signs and symptoms. So no two children show the exact same signs of depression. Some of the signs can include feelings of sadness, worthlessness, and hopelessness. Oftentimes, parents will notice a decrease in mood in their child. They may be feeling sad. They maybe have teary episodes. They may also express hopelessness and tell you moments of despair that they have. Another sign is decreased interest in activities and things that used to make your child happy. So for example, if your child loved to play guitar and you've noticed that they have absolutely no interest in strumming their guitar, or they don't want to play their guitar anymore, but this was an activity that they loved to do, this can be a sign of decreased mood. Another example could be if your child was on a hockey team and they've decided that they no longer want to go to practices and they no longer want to go to games. This can be another sign of depression or changes in your child's mood. Changes in eating habits. This can be seen through eating more or eating less. So oftentimes parents will see a dramatic increase in weight gain or dramatic weight loss. Changes in sleeping habits. So often this can be sleeping too much or too little at night. One other sign is frequent napping during the day. If your child gets into the car and you're driving to an activity and your child falls asleep and naps in the car, or if you have a teenager who has a spare in school and they go home to have a nap, this might also represent some changes in some low mood in your child. Not wanting to be around friends and family members, changes in energy levels. So this could be your child being more tired, more sluggish, but it can also be the opposite. So it could also be your child being restless, irritable, tense. We want to look for those dramatic changes in behavior or mood. Troubles concentrating and focusing. Specifically, we see this during school hours. So a child might have trouble concentrating on the lesson in class, or they might have trouble focusing on schoolwork. Parents will see oftentimes a dramatic decrease in their child's grades. And children might have a million excuses as to why they don't want to go to school. So that can be another sign or symptom that your child is struggling with their mood. Lastly, thoughts of death or suicide. This also includes self-harm and self-destructive behavior. Now, we know that children have days where they feel more sad than other days. Signs of depression become concerning when our child is showing days where they're more sad or having these signs and symptoms more often than days not. And usually, if a child is experiencing these signs for 2 weeks or more, or if these signs are impacting the child's daily life, so their ability to make friends, to keep friends, their ability to attend school or extracurricular activities, then then that's when we would be concerned with depression. The next slide is signs of anxiety. So as with depression, no two children present the same with the exact same symptoms of anxiety. Symptoms of anxiety usually present for a few months. So this is more of a long-term presentation. This isn't necessarily your kiddo who is an extra worrier and worries a little bit more than the typical child. This is excessive worrying for, a few months long. So oftentimes signs of anxiety include being afraid to be away from your parents, extreme fears about specific things and situations, being afraid to go to school or attend social events, being extra worried about the future or bad things happening to them. This can include signs of anxiety can be physical pains. So oftentimes our kiddos might say, Mom, Dad, I have a stomach ache or I have a headache. I can't go to school. Oftentimes physical pains are tummy aches, headaches, fatigue, nausea, vomiting. Those are all signs that our child might be anxious. Panic attacks are signs of anxiety as well. And poor concentration. This doesn't have to necessarily pertain specifically to school. This often is associated with our child having ruminating thoughts or spiraling thoughts or those racing thoughts. So if you have a child at home and you've said, can you please go pack your backpack? The bus is going to be here in 5 minutes. And your child just doesn't have the capacity to do that because they are fixated on the thoughts that are worrying them or the thoughts that they're ruminating on. That might be another sign that your child is struggling with anxiety. So, what to do when you think your child is struggling? I always encourage parents to talk to their children. I recommend avoiding the face-to-face conversations with your child. I don't encourage parents to actually sit down face-to-face with their child to have a conversation. Oftentimes, children don't feel comfortable doing that. It can be quite threatening for a child. So instead, I always encourage families to go for a walk, go for a drive in the car. You could also play a board game or a card game. That's a great time to have conversation, to ask your child how their day is, to just get some insight and information from your child. Remain as calm as you can. I know that this is extremely difficult, especially when our child expresses that they are struggling with their mental health. But it is really important to remain calm because our children feed off of our energy. So they need a safe and secure person to talk to. And, if that's not you, that is completely okay. But we can direct our children to a safe, calm, comfortable person where they can have a comfortable and safe conversation with a secure adult. So that could be a teacher, that could be a family member, that could be another adult friend. We really want to normalize mental health to our children. It is very normal for children, for youth, for adults to struggle with their mental health. As Barbara said, we really want to reduce the stigma that comes with mental health, and just having open and honest conversations with our kiddos around mental health will help reduce that stigma. When our children do come to us with mental health concerns or struggles that they're having, we really want to validate our child's experience. We can say things like, that sounds like it was a really hard day, or that was a really difficult experience. I can understand what you're feeling, or validating how they're feeling as opposed to fixing things. As parents, we always want to solve problems. We don't want to see our children hurt. We want to solve their problems. But it's really important to only fix things and solve problems when our child asks us to. So after validating our child's experience, we can say to them, would you like me to help? Or how can I support you? I always encourage parents to only give advice when advice is asked. One other thing I talk to parents about a lot is avoiding power struggles. We want to avoid power struggles with our kiddos. We also want to give our children choice and praise good behavior. Children will do well if they can. The next slide, these are 8 tips to help families thrive. And these 8 tips were developed by child psychologist, Dr. Bruce Perry. He developed these tips to help families stay regulated during times of stress and uncertainty, specifically during times of our global pandemic. So his number 1 tip is for families to have daily structure. So we know that children thrive when they're following routine. So we also know that children can tolerate stress when their home environment and their school environment is predictable and is routine. So when the world is so chaotic around our kiddos, especially during COVID, when our children are, sent home for online learning, and then they go back to the classroom and their extracurricular activities are canceled and they're wearing masks and they're not wearing masks. When the world is so chaotic around them, we know that children do best when their home environment has structure and routine. Again, I always encourage families to eat 1 meal a day together. This just allows you to connect, to communicate with one another. I encourage parents to ask questions like, what was your highlight of the day today? Or what did you struggle with today? Or what are you looking forward to in the following weeks? As opposed to asking that, how was your day question? That can be really huge and really daunting for lots of kids to answer that how was your day question. Limit media. I think we all know that we could probably reduce our time in front of screens. One thing that Dr. Perry really researched was the effects of violence and violent scenes on television, whether that's a television show or the news, on our children. And we know when children see scenes of violence, that increases the stress response in their body. So we really want to limit the violent scenes that children see. For example, we want to limit the exposure to COVID and the deaths related to COVID. We want to decrease exposure to the war in the Ukraine and to the school shootings. All of that exposure creates stress in our children. We also know that teens, and I would almost say that most adults, spend up to 5 to 8 hours on their social media devices or playing video games. So, we need to really reduce that. I always encourage families, turn the TVs off, turn the games off, go outside and get some fresh air, exercise, be out in nature. Exercise. Speaking of that, exercise, we know that exercise is so good for our mental health. When we participate in physical activity, it decreases our stress, it increases our mood, it can decrease anxiety, and it also can decrease depression. Reaching out. So connecting with others is a very, very important way that we can reduce the stress that we have, and we can reduce burnout. So it's important for parents, please reach out. You know, taking care of, like, as Liam said, taking care of your needs, taking care of your wellness, making sure that your bucket is full so that you can then care for the others around you is so important. You know, ways to fill your bucket are doing things that bring you joy. So, you know, being physically active, connecting with others, you know, doing art, listening to music, journaling, all of those things fill your bucket. So when your bucket is full, you can then help support your children or your other family members. Helping others. During difficult times, such as the pandemic, we know that it's important to help those in need. This can be simple acts of kindness, such as, you know, shoveling your neighbor's walk or picking up prescriptions for your aunt, for example. Little acts of kindness make us feel better when we help others. Sleep hygiene. This is a topic that we could spend a whole nother webinar on. I always touch on sleep hygiene in all of my counseling sessions. This is a really, really important topic to talk about as a family. One of the key things that I always encourage parents, you can start having good sleep hygiene by having a set bedtime and a very consistent bedtime routine. The other thing that we know is that it's important to reduce screen time at least a minimum of 1 hour before bedtime. Lastly, having a positive and future-focused conversations with our kiddos does help decrease their stress. Okay, this next slide. This slide is kind of the resource slide. So where to turn if you know your child is struggling with their mental health. I always encourage families to, if they think their child is struggling, they book an appointment with their family physician. And it's important to book an appointment where your child gets a physical exam and some blood work done, because we want to rule out any physiological reason why your child's mood or behaviors have changed. So, you know, by having a physical exam and blood work, we can rule that out. One thing to note is that many mental health clinicians cannot diagnose your child with a mental health disorder. If a family physician or a pediatrician, a psychiatrist, and some psychologists are the ones that do diagnose mental health conditions. A doctor or a psychiatrist are the only ones that can actually prescribe medication should your child need medication. So that's why it's so important to connect directly with your physicians so that you can have these conversations started should your child need further supports down the road. Access mental health. This is a non-urgent phone line that you can call. There is no referral needed to make this call. If you feel like your child is struggling with their mental health, you can call this phone this phone number, and you'll talk directly to a mental health clinician. This clinician assesses your child's needs, and they can refer you out to a program. So they know all of the programs within the Alberta Health Services and within the community. So all of those community-based programs such as Woods or Hull or Families Matter, all of these community programs, one of the Access Mental Health clinicians can make those referrals. Now, as we know right now, our medical system is really strained. So right now, the wait lists for some of these programs by Alberta Health Services are extremely long, and you can be waiting for up to 6 months, even more, to get into these programs. So there are supports that you can access in the time being. Kids Help Phone is a great support for your child. They can text, they can call, they can also online chat with somebody from the Kids Help Phone if they need support. The Distress Center, that's a great resource, not only for our teens and our young adults, but also for parents. Parents, if you are struggling, you can call or text the distress line, the Distress Center, and you will talk to somebody to help support you through the crisis that you are going through. 811, this is HealthLink. When you call 811, you will be directed to a registered nurse. They'll assess your child. They'll determine whether this is an urgent need where you need to take your child to the hospital, or whether this can wait and you should see a family physician, or if there's another outside resource that you can access. 811 will help direct you. As Liam mentioned in the previous set of slides, your school counselors and your school supports, that's a great resource for your children while they're at school and during school hours. As Liam mentioned, call your administrative team, call your school, your child's teacher, find out what supports are there for them at their school. Your place of worship, another great resource for you. Therapists, counselors, and psychologists. Many of us don't have wait lists, or many of us hold sessions aside for people who are in urgent need. So you can find a therapist, counselor, or psychologist. You can ask a friend, who do they see? Do they have any recommendations? Word of mouth is great. Your family physician should also be able to refer you to a therapist. There's also a great resource online. If you were to Google Psychology Today, it's actually a directory. Within that directory, you can put in your postal code, so you could find a therapist that is close to your home or that's close to your child's school. And I always encourage families to do a consult with a therapist, connect with them over the phone, and then determine whether you think this is a good fit for you and your child. If your child is at immediate risk of harming themselves or someone else, please take them to your local emergency department or to your urgent care clinic for a proper assessment. Feel free to screenshot or take a photo of this slide. Most of these resources you'll also find online if you Google them, but for just quick access, if you take a photo of this, then you'll have them, you'll have all the numbers right there on your phone. And you can share some of these numbers with your children and let them know that there are places that they can reach out to. I will also stick around for the Q&A, so if you have any questions, feel free to ask them then.
Thank you, Emily. That was incredibly informative, and your checklists, I think that they'll make a big difference in a lot of families' lives, just because having that kind of resource is really invaluable. And I really appreciated too how you spoke about you were not alone. You know, when your child is going through these things and you're seeing these lists and you recognize that your child is experiencing them, other children are too. And it is okay to talk to people about it and get that help that's needed. So
yes,
that's fantastic. And we'll definitely put in the future webinar slot sleep hygiene. So that's so fantastic.
Thank you.
So the next panelist we're going to have join us is Staff Sergeant Kainth. Jazz has seen as a CPS officer youth and mental health issues over the years. He's also going to speak about how things would have been easier for him if he knew he wasn't alone and what resources were available without stigma. So welcome, Jazz.
Hi, everyone. Thank you for having me. Thank you for allowing me this opportunity to speak. Thank you to the Calgary Police Foundation. Thank you, Barbara, for allowing me to feel like this was a safe and important place. I'm not gonna lie, I'm a little nervous. I despise being the center of attention, especially after Liam and Emily. Big shoes to fill for sure. What I'll be talking about today is my own lived experience. I also want to advise some of the people listening that some of the things I'll be speaking about may trigger some participants. So just be aware of that, be cautious of that. I wish I could provide you all with a magic checklist of symptoms exhibited by young persons in relation to mental health. As we all know, there's no magic checklist. Some symptoms, behaviors, and actions are obvious, you know, anxiety, depression, addiction. Other symptoms, not so clear. Some youth don't exhibit any symptoms at all. Some exhibit very subtle symptoms. I can attest to this. As only a short while ago, I sought help, psychological help for being sexually assaulted as a 6-year-old child. 2 years ago, I entered into this process of seeking help, and that was after 40 plus years of living with this trauma. I didn't want anybody to know essentially my deepest, darkest secret. I didn't seek help because of being constrained by feelings of guilt and shame. So guilt, how I felt guilt was, I felt like I did something bad and I deserved to be sexually assaulted as a child. I know that doesn't make sense, but that's how powerful of an emotion guilt is. And shame, that I was bad because I was sexually assaulted. Guilt and shame, I can tell you, dictated every decision I made in my life until not all that long ago. As a child, I learned to adapt to people and situations rather than be the person I really was. Even today, I'm 47 years old and I struggle to not be a people pleaser. If I wasn't able to adapt to the situation, to that person, what my coping mechanism was to disassociate myself. My mind would go somewhere else to a less anxiety-ridden place. I wouldn't detach. Detachment is numbing. That's not what I would do. I would just go somewhere else, go to a happier place, a place that wasn't the here and now. Very specifically, I just recalled an incident just a week ago about when I was in grade 2. I was 7 years old, and during an exam, a test, and the test I remember was very, very simple. It was actually single-digit adding, like 2 plus 3 is 5. So it was very, very rudimentary, very simple. But I remember during that test, I experienced a trigger. And all of a sudden, I forgot how to add. I couldn't add single digits. Very, very, very simple task. I just couldn't do it. So what I did is I disassociated. I went somewhere else. Obviously, I failed that test miserably. But what I do remember is That was in grade 2. That grade 2 teacher told my parents that she was doubtful that I would ever, she was doubtful that I had the cognitive function or ability to graduate grade 12. I wouldn't be able to graduate high school based on what she saw during that test. So when I heard that, I realized that I had to turn things around right away. If I didn't, people would know that there was something wrong with me. They would learn what I didn't want them to learn about me, that I was a sad, broke, hurt child. Just, I went to the extreme. I did end up graduating high school. I went on to attain a university undergraduate degree. So before I finally sought help, one of the main factors was that I felt like I didn't belong anymore. I didn't belong on this earth. I wasn't worthy. I felt hopeless. Some of the things that Emily alluded to and spoke about, those thoughts and feelings became prevalent. They were at the forefront. I wasn't worthy of anything good, such as being respected, being loved, feeling compassionate. Anytime anybody exhibited those feelings towards me, I resorted to what, how I coped as a 6-year-old child. I disassociated, I pushed them away, or I withdrew. I was an imposter for many, many, many years. I worked in the Calgary Police Service in the child abuse unit. I investigated sexual assaults of children. At that point in my life, I should have raised my hand to say, I can't do this. But I didn't. I didn't want anybody to think that I was weak, I was hurt, I was broken. So I just put on my imposter mask every day and soldiered on, for lack of a better word. I was a liar. I told children of sexual assault that, you know what, you're going to be okay. You're not alone. But yet I didn't believe that. That unaddressed trauma didn't allow me to take my own advice that I would be okay, that I wasn't alone. This is a planet of 7.53 billion people. Mathematically, how can a person feel alone? And I knew that I wasn't alone. I spoke to children, spoke to adults who experienced the same trauma that I did, and I knew I wasn't alone, but yet that part of my brain didn't allow me to recognize that reality. It's really difficult. It's a strange dichotomy. My rational self knew that I wasn't alone, that I would eventually be okay. But another part of my brain, knowing that, wasn't able to comprehend that, wasn't able to accept that. It was very, very difficult. So I know that we don't have a lot of time, so I will cut it short. But just know that anybody watching or listening, that you are truly, truly not alone. I know that it does feel that way, but you are not alone. That is what I want the listeners to understand, and that seek help. It's never too late. I've waited 40 plus years to seek help. It's not too late. You may seek help, and that first time, things may not work out. I encourage you to seek help again. And if that doesn't work out, seek help again and again and again and again, because you are worth it. So thank you, everybody.
Thank you so much, Jazz. I think your message is a very powerful one. Everyone needs to remember that it is never too late to seek help. And if you're doing it on behalf of yourself, or if you're doing it on behalf of your child, it is always important to take those next steps and keep taking them until you get to a place that is right. As well, Jazz, I can't say how much, I cannot overestimate or overstate how grateful we are that you spoke your truth, because with your speaking your truth, it allows other people to have the courage to speak theirs. And then we can all learn from each other and we get better. So that's fantastic. Thank you so much. I want to invite all of the panelists now to turn their cameras on. I'm going to do the old Brady Bunch gallery view for anyone who may be old enough to know the game Brady Bunch. And we are going to start our Q&A. Any of the attendees, you still have time to get a question in. So you know when you're looking at the questions, you will only be able to see your own question. And we do that so that you have privacy in what you're asking and feel comfortable with that. So we'll get started. I will read them out so that we can all hear them. And then I will leave it up to our expert guests to answer. So first question is, do all schools have a wellness counselor? Do you need parental permission to talk to a student to offer counseling services?
I can take that one. The boards within the city, the two public boards, the Catholic Board and the Calgary Public Board, they do operate differently in terms of the resources they have available. Within the Catholic Board, they do have specific wellness workers attached to schools depending on the need within that school, usually from the request for services they've had previously. So every school is different. That's why, reaching out, and again, Emily articulated that too, knowing what school your kids are in, what resources they have, you can navigate a little bit of that online, but also just a phone call or an email to your administrator or to the teacher to ask what they have available is a great place to start. And in terms of consent for your children seeing somebody, if there is a professional in the school, some schools have generalized consent that they might send home at the beginning of a school year. But anytime your child is going to be seen by like myself, I have consent with family. Families are the gatekeepers for me speaking and working with your children. But some kids do come in and talk to a school counselor just on a one-off, and it might just be about something they're having a rough day. And that usually gets communicated to the parents. And if it needs to be something more formalized and open up, similarly to a relationship you'd have like with Emily, you would go through a confidentiality and consent process. So there is a bit of a process to get your child on board to make sure that it's safe and official and everyone understands what they're getting into.
Thank you, Liam. One of our attendees asked if we are going to have this recorded, and this session is being recorded, so it will be sent out in a link to all of the people registered in about a week. And so you will have resources, this resource for you forever, which is fantastic. So good question from the individual who asked that. Next question is, I have a friend whose child refuses to go to school, and yet the school actually asked his parents to seek diagnosis and therapy outside of the school board. They're seeing a psychologist privately to try to remedy the situation. However, the school refuses to help otherwise and simply indicates that he should go to school. It becomes a daily hassle to try to get the school to the school, and it is becoming really stressful. It also increases anxiety for my friend, as my friend already has had anxiety. Where can they go for help outside of their own school? P.S. The child is 13 years old in junior high. Who would like to take that one? Emily, do you want to take that?
Yeah, I was going to say, Emily, if you want to speak to what's outside of schools, maybe.
It sounds like they are seeking a psychologist privately. So whether that's assessment based or that's counseling, I would start there. I would continue going down that road. I think, having the parents really communicate with the teacher, with the school, talking about what is working right now. These are the goals we're working on, and having maybe some set attainable goals for getting your child to school, and figuring out, I do have some clients that have different types of like re-entry to school plans. So maybe the goal of the day is that they attend, 2 of their preferred classes. And then the rest of the classes, they go to whatever school supports program they have, whether that's the library or a guidance counselor. But they work with the school to make it so that their child is successful at school.
That's great advice. Thank you, Emily. I have a question for Liam. This is I'm speaking for this person writing in. How well are you supported by school administration to be progressive and innovative with your students?
Great question. It definitely, school to school has kind of their own unique culture, and depending on the administrators they have and how they decide to roll out that school culture, there can be a little bit more flexibility with how you approach the work you do. That being said, the experience that I've had in the Catholic School Board, and even when I was in the public school board, there was always the opportunity for conversation in terms of what we could bring in. And it was usually based on what we saw as a need. So if I could advocate with colleagues strong enough for something, to do with a child's wellness, or to do with, the greater school wellness, then that was usually how we would allow things to come to be. New strategies, new research, new things that are coming out to enhance what's already there. So I'm encouraged to be creative. I've had a great year being really creative with a lot of unique individuals and students in terms of how we stay regulated and connected in a lot of ways. I've had to connect with families, especially through virtual or phone. We've had to be pretty unique and creative as well. And just speaking to, thank you, Emily, for answering that previous question. I just want to acknowledge there is a definitely strained relationships, I do know, between schools and the home environment. And I can't speak for everyone, but I've been on both sides of that. And I do think that if you can access things within the community, that is fabulous. And I hope that you have your own supports if you are being challenged in some way by the school, and maybe a little bit of pushback. That does happen at times, with some of the professionals who might be exhausted in their own way, and it doesn't make it right. And so I appreciate that person bringing that. That's a really real situation that families are going through.
Thank you. So the next question is for Jazz. It is about youth services section where you work. And I just have to say there's a lot of comments coming in. Thank you for sharing. I'm not going to go through them all, but just so you know, thank you for sharing. This is coming up regularly. So the question is, youth services section at CPS, how do you support youth?
The youth services section, it's very broad. There's I can go into detail. I'll try to keep it. I'll try to provide an overview. The youth services section consists of several programs. One being Cadet Corps, for example. There's Power Play. That is a program where in the winter, youth come to the Max Bell Arena for an hour on Wednesdays to play hockey with police officers, myself included. And during the summer, it's soccer. So unfortunately, tomorrow, because of the rain, we probably won't, Power Play probably won't be on. So there's that. There's a multi-agency school support team. There is a youth at risk development program. There's the school resource officer program. They're again in conjunction with the Calgary Police Youth Foundation. A lot of the funding for those programs comes from the Youth Foundation. It is just support. It's resiliency for youth. It's when you're in a situation to make a good decision. sorry, I don't know if I answered the question, but on a high level, that's what the youth services section does on a day-to-day basis.
Thank you, Jess. I think a lot of people don't know about those things, so it's great to talk about it. I know we are actually at 1:03, so we still have a number of people online, so we'll just go through a few more questions and finish this up. Okay, good. Thank you. I'm glad that you're able to stick with us for a couple more minutes. The question here is, any books you can recommend on the subject that can help parents?
Okay, any books on the subject? Can you say that again, Barbara?
Yes, any books on the subject of youth mental health?
Oh, yes,
that
yes.
meant for parents.
One book that's very, very highly recommended is Parenting from the Inside Out by Dr. Siegel. That's a really wonderful one. There's also a really great book for kiddos. It's called, oh, I have it in my bag here. It's actually more of a comic book, and it's all about anxiety. I'm going to grab it. And I'm going to show you because it's fabulous. I want to say it's maybe called The Power of Anxiety. And it's a book directly for kids, but parents can read that book with their child. Bruce Perry, Dr. Bruce Perry is a wonderful child psychologist. Anything from him is fabulous. There's so many great books out there.
Right. Well, those are excellent suggestions. Thank you. And then another question here. What are the things I could do when I feel my child is bullied at school, but not sure or not evidence? So I guess they believe their child is, but there's no hard evidence.
I can speak to that a little bit. There's definitely previous work. There was a lot of focus in schools in terms of having, this kind of like zero tolerance for bullying. I think trying to do their best to articulate what bullying is versus kind of just here and there in negative interactions. And so again, what I was speaking to earlier is there's a lot of kids who are struggling just in their day-to-day interactions and are unaware of the fact that they are putting other students into discomfort or into distress because of how they're interacting with them. And so it might be more passive and subtle ways of communication, whether it's malicious or not, but it can over time definitely for the receiver feel like bullying and feel like targeting. I've had these situations too, parents asking me, what's going on. And sometimes the best people to do that observation are the people that see them the most at school. So if you have the ability to connect with the teacher, and if they say they're not seeing it, they don't know. I think what Emily was talking about earlier is there's ways to start to talk to your kids to try to get, not to investigate them, but to try to get a little bit more information and try to get an understanding as to what it is that they're actually experiencing, because there are a number of kids there who have hypersensitive attunement to others as well and expressions. And so if a kid slights them by just not responding to them at recess or turning the other way in class when they ask a question, it might not be intentional, but your child could be the one receiving that as a harm and as a hurt. And it feels that way, even though it might just be miscommunication. And so I see that a lot too, is there's a lot of sensitivities and just communication not working out so well, and it being taken to a different feeling and thought than it was intended to be.
Well, please go ahead, Jess.
Thank you, Liam. Just to add to what you were saying, the word bullying nowadays it encompasses so much. My only suggestion to parents would be to be discerning, not to interrogate, but to be discerning and ask bullying. What does that entail? What does that mean? Can you be more specific to describe what those actions are and how those actions make you feel?
Yeah, good addition. And also that bullying can be done online too, that it can take different forms.
Barbara, I have the name of the book.
Oh,
I think
good.
it's called Superpowered: Transform Anxiety into Courage, Confidence, and Resilience. This is the comic book. And it's like it's kind of got lots of pictures in it. It's a good book to read with your kids.
That's fantastic. Great resource. Thank you, Emily. So we're coming up at 10 minutes after. What I'm going to do is I will save all of the unanswered questions. And then when we send out the resources afterwards with the link to watch this recording, we will see if we can answer as many of them as possible there so that they are for everybody. So all of the attendees know you're going to receive an email with a survey in it where we will ask for your feedback on our webinars so that we can continue making these incredible webinars that are free for everybody to learn from. On behalf of the Calgary Please Use Foundation, thank you to our presenters today. You have been inspirational and educational for all of us. We're so grateful to you all. Thank you. To everyone who attended today, thank you. I hope that you learned what you needed to learn. This will be, like I said, available as a resource for you to watch again and again. We will share that link with you in about a week. Thank you, everyone. Take good care. Stay well.